Hi everybody, my name is Dr. Mike Blaney. I'm a general and bariatric surgeon in Augusta, Georgia at Live Healthy MD. We are a comprehensive surgical and medical weight loss center. We're going to talk today about some common questions that I get asked by my patients. And one of these that we were recently asked was, how much weight should I expect to lose after a duodenal switch? Now, if you're not familiar with the operation known as the biliopancreatic diversion with duodenal switch, commonly referred to as the duodenal switch or the DS, you can look at our other videos that we have posted where we go into depth in this operation. In the field of weight loss surgery, there are three operations that we perform most, and that's the sleeve gastrectomy, the gastric bypass, and the duodenal switch. And in general, when I'm counseling patients about expected results, what I tell folks is to think of your results in terms of percentages, the percentages of excess weight that we expect to lose. And that's how I'll refer to it today, as opposed to absolute numbers, because everybody's different. So to make it easy for math, let's say we start at a preoperative weight of 250 pounds and our goal is to be 150 pounds. So we have 100 pounds to lose. So obviously, if we lose 100 pounds, we've lost 100% of what we would like to lose or need to lose. If we lose 50 pounds, we've obviously lost 50%. So generally speaking, I do not personally, in my experience, see tremendous difference in results in the beginning phases after weight loss surgery. So what I tell patients is the milestones that I like to see as they progress from the time of surgery till the time they stop losing weight, which is typically going to be about a year or 18 months after surgery, is this. I like to see about 10% body weight loss, which typically will equate to about 20% excess weight loss during the first 6 to 8 weeks or so. So for that individual that needs to lose 100 pounds, will probably lose somewhere in the 20 to 30 pound range. The weight loss after the duodenal switch will typically be about 20 to 30% greater than the weight loss that we see after the sleeve gastrectomy or the gastric bypass. Typically after about 4 to 5 months, I expect an individual to lose about half of the weight that they're going to lose. So for that individual that needs to lose about 100 pounds, will probably lose 40 to 60 pounds at the 4 to 6 month mark after surgery. And then generally speaking, the individual will then slowly lose the rest of that weight over the next year or so. So hopefully an individual is going to lose all of the weight that they want to lose. But remember, you don't have to lose 100% of all of the weight you want to lose in order to have a significant improvement in your overall health and quality of life. Generally speaking, the sleeve gastrectomy and the gastric bypass will have very similar weight loss results. I'll tell patients that I expect to see about 10 to 20% more weight loss overall with the gastric bypass than the sleeve. And then with the duodenal switch, I'll expect to see about 20 to 30% more weight loss with the duodenal switch than the gastric bypass. So overall, the duodenal switch is going to provide a patient with a greater degree of weight loss, and as a result, a larger percentage of their excess weight will be lost. So that's why in our practice, we tend to lean more to the duodenal switch for those patients who are much heavier. For patients who tend to have weights in the body mass index range of the upper 30s and into the low 50s, the sleeve gastrectomy and the gastric bypass are going to provide excellent results without some of the negative side effects that may go along with the malabsorptive component associated with the duodenal switch. But as patients' weight starts to get well into the 50s, particularly over 60, the duodenal switch is going to provide them with a greater percentage of that excess weight loss, hopefully to achieve a healthier, medically safe weight, which generally I would define as certainly less than 35 body mass index, and hopefully less than 30. And again, those individuals who are in the lower weight ranges are going to probably achieve those goals with the sleeve or the bypass. But when our weight is well into the 50 body mass index range, or particularly over 60, sleeve or bypass may not provide that patient with such a degree of significant weight loss that their body mass index ends up in under the 35 and under the 30 range. And that's why you know, I personally start to look to the duodenal switch again for that reason. So I hope this information was helpful. Thanks for watching. If you like this video, be sure to give us a thumbs up and subscribe to our YouTube channel, and check out other interesting videos that cover the topics of weight loss surgery and obesity.